Hello everyone, my name is Sue Barrosse and I'm Director of Admissions for Tulane School of Public Health and Tropical Medicine. Today's program will be about the Maternal Child Health program here at Tulane. And my guests today are Dr. Carolyn Johnson and Shokufeh Ramirez. Dr. Johnson?
Hi, I'm Dr. Carolyn Johnson. I'm a professor here at the Tulane School of Public Health and Tropical Medicine. I'm also the head of the Maternal and Child Health academic program and director of the Center of Excellence in Maternal and Child Health.
And I'm Shokufeh Ramirez. I'm the assistant director of the Tulane Center of Excellence in Maternal and Child Health.
Thank you for joining us. Let's start by having you describe what is actually meant by MCH, Maternal Child Health.
Thank you for allowing me to have the opportunity to clarify this. First of all, there are a lot of folks who think that maternal and child health means reproductive health. Actually, maternal and child health, or MCH, refers to any service, program, or research on issues related to women, children, adolescents, and families. And that sounds like just about everybody, and it almost is.
It does.
But these are issues that are specific to this population. The services and programs and research are practiced both nationally and internationally here at the Tulane School of Public Health. And we are involved both nationally and internationally in this program.
Okay. Well, can you give us a little bit history and background on MCH?
Sure, and it's pretty interesting really, because maternal and child health services funded by the federal government is the oldest uninterrupted federally funded service in the United States. It was actually started in 1934 as an act in the Social Security Act, and it is better known as Title V. We have the Bureau of Family Health here in Louisiana, which is our Title V program. And these services include, Shokufeh, you can help me here. There are services for children with special health care needs. There are services for autistic children. There are services for children who are hearing challenged. Anything else that you might mention?
I mean, they serve as the safety net for all of the MCH population, so providing the services and programs that help support that population across the state.
There you go. And as I said, uninterrupted funding since 1934. So that's really very exciting when you think about that. So then we come to Tulane School of Public Health and Tropical Medicine, which, as you know, is over 100 years old. We were founded in 1834, and we're the oldest school of public health in the United States. Now, with regard to the academic program in MCH, in Maternal and Child Health, that has been active in the schools since 1984. So we've had a lot of time to learn about what we're doing, and we feel like we're very well experienced in the field.
Well, several decades of background for sure.
Yes.
Well, how does the MCH program fit at Tulane?
So the MCH program here at Tulane is concerned with training the future public health professionals who are focused on the health of, as was said, women, infants, children, adolescents, and families, with an eye on improving the health of generations to come. In addition to a strong academic program, we also have, as mentioned, the Tulane Center of Excellence in Maternal and Child Health, or KEMCH as we call it. And the focus of the KEMCH is to enhance the academic experience of our students to better prepare them for the workforce to help them be maternal and child health leaders.
Okay, ladies, what can a student expect when they enroll into the program here?
Well, when students enroll in the Maternal and Child Health program here at Tulane, they get the same school foundational courses that any school of public health in the United States offers. And these core courses or foundational courses are required by the accrediting body for schools of public health. Here at the departmental level, students learn skills that are important for their professional attainment, such as monitoring and evaluation of programs, program planning, and those skills are required of all public health professionals. But our students also learn about social and behavioral issues, theories, and that's required at the departmental level. But at the academic program level, we have 4 foundational courses, and those those courses present emerging issues and essential issues in maternal and child health, so it's updated every year. We have a course in evidence-based programs so that students, even though they're not involved in research, can understand the research and data and how to turn the research into practice. And we have issues in maternal and child health from the life course perspective. So over time, as those issues emerge. And then we have a course on policy, which basically encompasses federal funding and the Title V program. But that's just the beginning, because our students are exposed to a wealth of experiences and information. As Shokufeh mentioned, we have the Center of Excellence in Maternal and Child Health, and if a student applies, they can become a scholar in that program, and it largely enhances that experience at Tulane. We also have many community partners that we work with that do MCH work, and students go to them and do shadowing rotations. They do outreach work. We have the Bureau of Family Health, which is at the state level. Students do their practica there. We have faculty who are practicing maternal and child health domestically and internationally, and students have the opportunity to work with these research programs should they care to do so. Shokufeh might give some examples of that research.
So some of the research that our faculty are doing, and as was mentioned, our faculty are doing a wide range of work, and part of that is influenced by the fact that they have backgrounds in a wide range of disciplines, including medicine, psychology, anthropology, social work, and social epidemiology. So they're combining those perspective and skills together with background in public health to carry out research such as opioid use among young adults, the influence of neighborhood conditions on youth and family violence, and the effects of yoga and mindfulness training on the stress of school children. So that's just a snapshot of some of the things going on.
It's quite a variety of experiences.
Very wide range, yes.
Definitely. What kinds of professional positions will these students be qualified for and eligible for?
Well, you know, through her position as assistant director of the camp, Shokufeh follows most of our students to see what kinds of professional positions they go into. So she can give you a handle on that.
So there is a lot of flexibility in terms of the electives students choose and their practicum. And one of the benefits of the KIMCH is that we do provide mentoring and network connections to students, help them further clarify what they want to do and how to do it. And so it is up to a student to determine what path that they're taking so that they can develop the skills needed while they're here. But some examples of recent graduates recent jobs our graduates hold include developmental screening and early intervention coordinator with a state health department, a child policy specialist at a humanitarian aid organization, a project coordinator for a research project focused on the mental health needs of LGBTQ persons, and a manager of surveillance of mortality in maternal and child health populations to help prevent future fatalities.
And I'd just like to mention that we have a very high success rate because over 90% of our students find professional positions after they graduate from Tulane. So we think that's pretty good.
That's an amazing statistic. Well, it sounds like both of your careers are very rewarding. Can you tell me, since you've been involved in MCH, some of the rewarding experiences you've had?
Well, I think for me, the most rewarding experience as a teacher and head of this program is seeing our students go into professional positions, and the excitement and interest and enthusiasm they bring to these positions, including the skills they learned here at Tulane. And there's nothing so rewarding for me as when I go to a national meeting or a meeting here at the school locally, and somebody walks up to me and says, Dr. Johnson, I was in your class, you know, in such and such a year, or as a student here some years back. And let me tell you about what I'm doing now. And
Wonderful.
that really, it makes me preen.
I bet. bet. Shokufeh, have you had some wonderful experiences?
Yeah, I mean, very similarly, I really value getting to see the growth of our students and going to a meeting and getting to work with them as professionals. And I think it really is an honor to be part of the growth process of each of our students as they gather the tools they need to be able to do the work that they want to do, and then get to hear about the jobs they're having or the opportunities they have after they leave here is really satisfying.
Well, I do agree that our alumni and our networking are amazing. Well, what advice would you have for a potential student who is looking for a rewarding career?
Well, we do come across some students who, once they decide to get a master's, they look for an academic program that will assure them of a quick job. And I would not advise students to enter an academic program at the master's level based on that. I think a student should think about the fact that once they get their master's, they're going to be working in this field for many years. So they really should look for an academic program that excites their interest, something they can be enthusiastic about. And I should be pitching MCH, but I'm not going to do that. I think a student really needs to find that program that welcomes their niche, that they are excited about, and that they're even passionate about. Because then if they have that, and then they learn the skills, they've got to be successful.
Yes. Shokufeh, any advice?
Yeah, I would echo. I think it's helpful to pay attention to the experiences one enjoys, and then build upon that in one's career, because hopefully you're in it for a while. And so to just think about what are the specific ways in which you want to contribute to the world and improve the lives of others.
Oh, wonderful. If our viewers have any questions, I understand there's lots of social media out there for your department and your programs and centers, and I will be able to supply the link and the email address for your department.
Great.
After this is over. Thank you very much, Dr. Johnson. Thank you, Shokufeh. I definitely enjoyed having you here today, and thank you to our listeners.
Thank you.
Bye-bye.